We are here today. We are going to be doing a demonstration for you about how to conduct a health history screening, and we are going to be taking you through how to determine if there are risk factors and signs and symptoms for a patient. So we're going to start, and that way you can observe. Hello, my name is Dr. Juhala. I'll be helping evaluate you in your appointment today. What was your name?
My name is Varian.
Nice to meet you.
Likewise.
So it looks like, are you comfortable?
I am in a very comfortable position.
I am as well. Okay, so earlier today we gave you some paperwork and you filled out your health screening questionnaire, and you also filled out your health history questionnaire. So we have two things. As you see here, we have the participant complete and exercise pre-participation health screening questionnaire. And in this questionnaire, the very first one, we looked at signs and symptoms that the patient might experience. Did you experience any of these signs or symptoms?
No.
No. The second step is to check their current activity levels. Are you currently physically active?
I do not have any planned physical activity programs.
Okay, so no. And do you have any other medical conditions listed here?
No.
No. Okay. Some of those medical conditions are a heart attack, surgery, heart failure, renal disease. The patient does not have any of this information. And according to our screening questionnaire, we have seen that medical clearance is unsure if they need it based off of the activity levels alone. So we're going to continue on with our evaluation. So you filled out the health history questionnaire. We have quite a bit of information about you. Tell me more about yourself. So do you have, it says here that you have high diabetes, or not high diabetes, you have high blood pressure.
I do, and I use medication, and it's still high.
And it's still high, okay. Yeah, I saw that when we took your blood pressure earlier today, it was just over our limits. So it is still high, even with medication. Do you take your medication regularly?
I try to.
Try to, okay. When was the last time that you saw your primary doctor?
I haven't seen him for over a year.
Over a year, okay. Let's see, it says that you also smoke?
I smoke marijuana 3 days a week.
3 days a week, okay. And so you don't currently exercise, you do smoke marijuana, and okay. And for your exercise, do you have any exercise goals that you would like to start exercising?
I love hiking, but I'd be interested in starting a strength training program.
Okay.
A regimen.
That's awesome, yeah. Any type of regular activity, and we'll evaluate today if that's good for you to actually start. So we are going to perform a PAR-Q, 2019 PAR-Q, and we're just going to ask you some information. So I already had you look at this a bit. You said you do have high blood pressure.
Yes.
That's a yes. Do you have any of these other things? No.
I am currently taking prescribed medications.
Okay. And looks like everything else is a no?
No.
Okay, so you have high blood pressure and you are taking medications for it. So we're going to move on to the next page of our PAR-Q. So we're going to see if the patient has any of the other symptoms listed on the next two pages. Do you have anything listed on this page?
Yes, I have difficulty controlling my high blood pressure, even though I'm taking medication.
Okay. And as we saw today when we took your readings, your resting blood pressure was greater than normal levels as well. Do you have any of these other risk factors?
No.
And on the second page of our form, do you have any other ones?
No.
Okay. So based off of our 2019 PAR-Q plus information, we have seen that we actually are going to need more information before we give an exercise recommendation. We have an online screening tool, ePAR-MedX, and we can give you the link to that. That way you can fill it out online. But we will want to get some more information from you before we give you an official exercise program. But based off of the information that you gave me in your health history form, you do have a few risk factors that I just want to go over with you. That way you're aware of them. So in general, your first risk factor would be your age. Any male over the age of 45, it's just a risk factor for a potential health problem. Your BMI was just over 30. It's okay. Smoking, that was a risk factor. Again, when we took your blood pressure today, it was slightly higher. And we also see that you're not physically active, but that you were interested in being physically active. So that was good. So those are 5 different risk factors that I did see based off of my professional opinion and based off of how much you said that you are taking your medication and the last time you saw your doctor. I would recommend that you do start with some light activity for a lot of these issues. Like, for example, you said you have high blood pressure, but I also see in your survey that you said you still consume a good amount of alcohol. Do you still do that?
Yeah, most nights.
Okay, so you could talk with your primary care doctor about that. Again, when we took your blood pressure today, it was still high even though you said you're having medication. So consuming alcohol can contribute to high blood pressure, so you might want to talk with your primary doctor about controlling that. But in general, I would want to start you on some light physical activity. It says here that you like hiking. So we'll have you fill out that online survey. We'll give you the link for that. And then I would want you to start some type of light physical activity. And in the meantime, I also want to take you through one form. So I have an informed consent for participation in health and fitness training program. So I'm just going to walk you through this so that you understand what we are doing. So this first part of the form, as you can see, this is our form. So generally, we're saying that this is a voluntary program. You would basically be agreeing for us to develop an exercise program for you. Again, we still need to get your official survey online. You will want to check in with your doctor regarding your blood pressure and the medication. But this would basically be saying we want to design a program for you. You would be willing to participate. You would be willing to work with our trainers. And I'll let you read this over as well. I'll just give you the general overview. It talks about risks here. Again, when you are exercising, there is a risk with any type of exercise. For example, you have high blood pressure, so you might experience a rise in heart palpitations, or for example, if you're not drinking water, you might begin to feel faint and dizzy. But again, we will have people that are monitoring you. We'll be asking you to inform us of your symptoms as well. There are benefits. Again, this is exercise, and we have seen that physical activity in general is good and would benefit you. And you'll also be learning the proper ways to perform exercises. We'll have a care team walk you through how to perform everything. And again, your information is confidential. No one else will have access to it. No one. And inquiries. Do you have any questions about this? No? Okay, so I'll sign this whenever you're ready. Thank you. And we now have your consent form. Let me see if I need any other information from you today. I'll let you keep reading it in the meantime. And let's see. I got your signature. We walked you through. All your other risk factors were okay. You were good when you don't have hyperlipidemia. Your cholesterol levels came out okay. Your LDL levels and your HDL levels, everything came out okay. Your fasting glucose, those numbers were low. Your family history was fine. That wasn't a risk factor. Yeah, you should be good to go. So do you have any other questions? We will be providing you with the link to take that online test. Any other questions in general?
I do not have any other questions.
No other questions. Okay, well, let us know if you do have any that come up, and yeah, we will see.